You've heard it your whole life. Eat more vegetables, load up the leafy greens, the more colorful the plate, the better. And that's genuinely good advice. It's just not the complete picture, because one specific type of vegetable, one that doctors push, nutritionists celebrate, and every health headline puts on a pedestal, can raise stroke risk in seniors. Not gradually, not from decades of poor choices. One evening, one large serving, and by the next morning, something has shifted inside your body that didn't have to shift. That's not a headline trick. That's biology. And once I walk you through the mechanism, it makes complete sense. Now, before we go any further, I want to be clear about something. This isn't a scare video. I'm not going to tell you to throw out your salad or avoid the produce aisle. What I'm going to do is explain something that rarely comes up in a 15-minute doctor's appointment, something that becomes specifically relevant when you hit 60, and critical if you're already managing any kind of heart condition. Once you understand it, you can protect yourself. Starting today, here's the short version of what we're covering. The physiology first, what's actually happening in a senior's body that creates this risk. Then the specific vegetables, what makes them dangerous in certain situations, and what to actually do differently. Some of this is going to surprise you. If you're over 60, or if you have a parent or spouse who is, this is one of those things you'll be glad you know. Your blood vessels aren't the same at 65 as they were at 40. The walls get stiffer. The lining becomes more prone to inflammation. Small clots form more easily. And the margin for error, the window where your body can compensate for a bad meal or a missed dose of medication, it gets narrower. Now add to that the medication reality. An estimated 1 in 3 seniors over 70 is taking some form of blood thinner. Warfarin is the most common, prescribed for atrial fibrillation, which affects millions of older adults, as well as for clot prevention after heart procedures. And warfarin is genuinely powerful. Research confirms it reduces stroke risk in atrial fibrillation patients by roughly 64%, nearly 2/3 of strokes prevented from one medication. But warfarin has a serious problem. It works by blocking vitamin K's role in clot formation. That's the entire mechanism. And vitamin K is extremely abundant in leafy green vegetables, spinach, kale, broccoli, Brussels sprouts, the exact foods most seniors are being actively encouraged to eat more of. So what actually happens when you eat a large portion of one of those vegetables inconsistently? Your vitamin K levels spike. Your body starts producing clotting factors again, and the warfarin that's been quietly standing between you and a stroke loses some of its effectiveness. Sometimes a lot of it, within 24 to 48 hours. Studies on elderly patients show that vitamin K intake above a certain threshold measurably decreases warfarin sensitivity. In a randomized crossover study, researchers found that a significant change in vitamin K intake shifted key clotting markers by nearly 30% within 7 days. That's not a slow drift. That's your stroke protection changing in the span of a week based on what was on your plate. And this goes both ways, which is the part that really catches people off guard. It's not just about eating too many greens, it's about eating them inconsistently. Someone who has a small portion of spinach every day has a completely different risk profile than someone who eats an enormous kale bowl once a week. The body doesn't average things out, it responds to what you gave it today. Most people on warfarin have heard something vague about watching the greens, but vague doesn't protect you. And their doctor, who has 12 patients booked after them, doesn't always have time to sit down and explain the actual mechanism. This is where it gets real. 5 years from now, 10 years from now, the seniors who understood this are still driving themselves to appointments, still getting down on the floor to play with their grandkids, still living in their own home on their own terms. The ones who didn't, some of them will have had a stroke that, on paper, shouldn't have happened. Someone who was on the right medication, someone eating what they believed was healthy food, doing everything they were supposed to do. Except this one specific thing nobody explained. I've seen it happen, and they almost always say the same thing. I wish someone had told me sooner. So let's talk about the specific vegetables, which ones carry the highest risk, and exactly what you need to know. The vegetable at the center of this is spinach. And really, the whole family of dark leafy green spinach belongs to kale, broccoli, Swiss chard, Brussels sprouts, collard greens. These are, genuinely, some of the most nutritious foods on the planet. I want to be clear about that up front. The problem isn't what they contain. The problem is what they contain interacting with one of the most commonly prescribed medications in seniors over 65. Leafy greens are loaded with vitamin K. For anyone not on blood thinners, that's mostly a good thing. Vitamin K plays a role in bone health, in keeping arteries flexible, in a dozen processes your body needs. Eat all of it. But for the roughly 1 in 3 seniors on warfarin, the picture is different. The research shows that vitamin K intake above 250 micrograms per day starts to measurably decrease warfarin sensitivity, and a single large serving of cooked spinach or kale can push you well above that threshold. One portion, one meal, and suddenly the medication calibrated to keep clots from forming inside the chambers of your heart, in your leg veins, wherever your doctor is specifically worried about, is working less effectively than the dose was designed for. Okay, and I want to correct something I was about to say. My instinct just now was to tell you to avoid spinach if you're on warfarin. That's the wrong message, and it actually creates its own risk. So let me be more precise about what the research is actually pointing to. The real danger isn't eating leafy greens, it's eating them unpredictably. Someone who eats a consistent portion of these vegetables every day, their doctor can factor that in, calibrate the warfarin dose to match, and their protection stays stable. Their clotting balance stays where it should be. They're fine. The person at risk is the one who eats barely any greens for 2 weeks, then has a large kale salad, then goes another stretch without touching them. Every swing is a swing in their clotting protection. Every swing is a window where something could go wrong that otherwise wouldn't. This is the part most people on warfarin have never been told explicitly. Consistency matters more than quantity. A moderate, regular amount of vitamin K-rich vegetables is genuinely safer than irregular large amounts. Your medication can be calibrated to a steady intake. It cannot be calibrated to a moving target. If you're on warfarin and you're not sure whether your vitamin K intake has been consistent, that's a specific conversation worth having with your doctor, not a vague mention. A direct conversation about how well your blood is clotting and whether your current dose actually reflects your real eating patterns. Now, that's the primary mechanism, but there's a second category of vegetables that gets far less attention, and this one catches people off guard because it has nothing to do with blood thinners. It affects seniors whether they're on medication or not. The second pathway runs through blood sugar, and before you think that's a diabetes thing, that it doesn't apply to you, hear me out, because this affects seniors well before any diabetes diagnosis, and it's connected to stroke risk in ways that most people never hear about. As you get older, your body becomes less efficient at managing rapid blood sugar spikes. The same meal that a 35-year-old burns through without issue can push a 65-year-old's glucose level significantly higher and keep them elevated longer. That's not disease, that's aging. It happens gradually, and it happens in nearly everyone. And a sharp spike in blood sugar right after eating has been identified as an independent stroke risk factor, separate from diabetes, separate from any underlying condition. The spike itself causes vascular damage. Now here's where it connects to vegetables specifically. Certain vegetables sit very high on the glycemic index. They digest rapidly, flood the bloodstream with glucose quickly, and produce exactly the kind of spike we're talking about. Potatoes are the most significant one. Not processed food, not a bag of chips. Potatoes, boiled, mashed, baked, rank among the highest glycemic foods in the entire diet. Corn, parsnips, overcooked beets. These show up in the meals of seniors who genuinely believe they're eating well. So what does the research actually show on this? A large prospective cohort study, over 44,000 participants followed for 11 years, found that high glycemic food consumption was associated with an 87% higher overall stroke risk. Hemorrhagic stroke, the bleeding type, was 3 times higher in the group eating the most high GI foods compared to the group eating the least, 3 times. That's not a marginal finding. That's not a signal buried in the noise. That's the difference between the person who has a stroke in their 70s and the person who doesn't, with diet as a significant variable. And potatoes are the most common high glycemic food in the senior diet. Not because seniors are eating badly, because they've been told vegetables are good and potatoes are vegetables, and the logic seems to check out. Let me share something here. I was talking to a woman not long ago, late 60s, active, genuinely careful about her health. She'd cut out most processed food, she was exercising, managing her blood pressure, and she couldn't understand why her cardiovascular markers kept drifting in the wrong direction. When we got into the specifics, there it was. Every night with dinner, a meaningful portion of mashed potatoes, sometimes roasted. She'd been told vegetables were good. Nobody had explained this particular distinction. Actually, and I want to be precise here because this matters, I'm not saying potatoes are the problem in isolation. A small amount of potato alongside a high-fiber, high-protein meal is a very different blood sugar event than a large bowl of mashed potato by itself. The same food can be moderate risk or high risk depending on portion size, frequency, and what else is on the plate. That's the actual nuance. But the senior body doesn't get the benefit of the doubt the way a younger one does. Remember what we said about the margin for error narrowing. That's exactly what's happening here. A spike that a younger cardiovascular system absorbs and moves on from is a spike that a 68-year-old body is managing less cleanly, night after night. And here's what makes this risk so hard to catch. Unlike joint pain that wakes you up stiff, unlike breathlessness on the stairs, blood sugar spikes don't announce themselves. You don't feel the vascular inflammation building. You feel fine. You had your vegetables. You went to bed. And somewhere in the background of your cardiovascular system, damage was quietly accumulating. The first sign something was wrong for too many people is the stroke itself. Both mechanisms we've covered, the vitamin K interaction and the glycemic pathway, are silent. They work in the gap between what you thought you were doing and what was actually happening in your body. That gap is closable, but only once you know it exists. So let's close it. There's a third mechanism to cover, and this one has the quickest fix. Canned vegetables, pickled vegetables, the ones that get labeled healthy without much scrutiny. Canned tomatoes, canned spinach, canned peas, jarred roasted peppers. These carry hidden sodium in amounts that catch most people off guard. A single can of standard vegetables can contain anywhere from 400 to over 800 milligrams of sodium. The American Heart Association recommends seniors stay under 1/500 milligrams per day total. That means one can of vegetables at dinner can represent more than half your entire daily sodium budget before you've touched anything else on the plate. And sodium at that level, consistently, drives blood pressure up. High blood pressure is the single largest modifiable risk factor for stroke, not one of the top factors, the top factor. So yes, technically it's a vegetable. The sodium riding along with it is doing the opposite of what you think that vegetable is doing. The fix is genuinely simple. Low-sodium canned vegetables are widely available and taste nearly identical, or drain and rinse the standard ones under water. You can cut the sodium content by around 40%. 30 seconds at the kitchen sink, not a lifestyle overhaul. So now we have 3 mechanisms and 3 things to act on. First, if you're on any blood thinner, have a specific conversation with your doctor this week. Not a general check-in, not a vague mention. Tell them you've been thinking about your vitamin K intake and want to understand whether your current warfarin dose actually reflects your eating patterns. Ask specifically about how often your clotting levels are being checked and whether your dose still fits your diet. A well-calibrated dose with steady vitamin K intake is powerful protection. An uncalibrated one, with a diet that swings week to week, isn't doing the job it's supposed to. Second, take a closer look at how your high glycemic vegetables are landing on the plate. You don't have to give up potatoes. What you can do is pair them differently. A smaller portion of potato alongside protein and a non-starchy vegetable is a completely different blood sugar event than a plate where potato is the centerpiece. That one shift in how you build the meal changes the whole equation, and it connects directly back to what we said about the margin for error. The senior body doesn't absorb those spikes the way it used to, but you can manage the spike itself. Third, flip the canned vegetables. Check the sodium. Switch to low sodium where you can. Rinse the ones you already have. 30 seconds. None of what we covered today means vegetables are dangerous. That's not the takeaway. The takeaway is that a senior body, with a senior medication list and a senior cardiovascular system, interacts with food differently than it did 20 years ago. And most of the advice out there was written for a general population, not specifically for you. The woman I mentioned, once she understood this, she made 2 small changes. That was it, 2 changes. And her numbers started moving in the right direction. You're not behind. You don't need to overhaul everything. You just needed someone to explain this specific thing in enough detail that it actually made sense. That's what I was trying to do today. If this was useful, hit subscribe. I put out videos on exactly this kind of thing. the nuance that gets missed in a standard appointment. And if you have someone in your life who's over 60 and on blood thinners, share this with them, because there's a good chance nobody's walked them through this either. Take care of yourself. I'll see you in the next one.